Hello, and welcome to Hadassah On Call, New Frontiers in Medicine. I'm your host, Maayan Hoffman. COVID-19 cases are surging once again in the United States. Mpox continues to spread in parts of Africa, and Israel faces warnings about West Nile virus. Infectious diseases caused by viruses, bacteria, fungi, and parasites can spread through person-to-person contact, contaminated food or water, or even bug bites. Rising infectious disease rates are increasingly linked to climate change. Shorter, warmer winters and longer summers are creating conditions ripe for the spread of vector-borne diseases. Travel also plays a role in the spread of infectious diseases. While travelers are at higher risk of exposure, they can also inadvertently carry diseases to new areas. When a novel pathogen enters a population with no immunity, the results can be particularly severe. To talk about this and other related challenges, we have with us Professor Yaakov Strahilevitz, head of the Department of Microbiology and Infectious Diseases at Hadassah Medical Organization. Welcome, Professor Strahilevitz.
Good morning, Maya. Nice to be here.
Wonderful. So I want to start with a little bit of storytelling. I understand that you have been deeply involved in treating a patient who was bitten by something we don't normally hear about in Israel, which is a crocodile. Can you share the story and explain the process of identifying the bacteria from the crocodile after the attack and how this knowledge influenced the treatment plan of the victim?
That's a nice story. Not for the patient who was bitten by the crocodile. This is the first time that I encountered this kind of biting from an animal, and I guess that this is the last time that I'm going to see a crocodile bite in my career. So I will tell you about the bacteria that we isolated from the crocodile and from the patient. But beforehand, maybe I can tell you about how we handle such cases. So the infectious disease physicians should know what's in the mouth of the animals that are potentially source of infection to the patients, and the way that we manage these patients. What is very common in Israel is cat bites and dog bites, so we know which are the bacteria there, and more than which bacteria there can cause serious infection, and we treat them with antibiotics prophylactically. Because the infection from these bacteria, especially from cats, can happen very quickly. So same applies for other animals. And so for the crocodile, I thought about it like a snake, even though it's not, because they eat the same kind of animals and they live on the ground. And the crocodile, in addition, well, specifically this one, they live in ponds. When I thought about the bacteria that I should treat or prevent causing an infection in this patient, I thought about the crocodile like a snake with respect to the animals that it eats and the bacteria which affect the bacteria in its mouth, and also the fact that it lives in a pond or in brackish water. Where there are certain bacteria that we are familiar with. So the patient received the antibiotics against these bacteria, and not surprisingly, actually, we isolated from the patient's wound quite unusual bacterium, which is called Aeromonas, and we could also grow this bacteria from the crocodile teeth. Obviously, we grew it from the teeth after the patient already received antibiotics and after he was operated, and fortunately, he didn't have any infectious complication from this wound, which was severe by itself.
He got the bite in Israel?
Oh, yeah. It was in the... I don't know how it's called in English. It's the Gan Chayot Tanachi.
Oh, he was in the biblical zoo.
I think so.
Yeah, that's here in Jerusalem. Yeah. And the crocodile, he went into the pond with the crocodile, or the crocodile came out. This is a great story.
Oh, no, he went in to give the crocodile food and to clean the water.
Oh, he works there.
And he just and he slipped over, and the crocodile caught him.
Oh my goodness.
Yeah.
Wow, that's a crazy story. And then just another question with regards to the infection. So you mentioned how cats, like, what bacteria and it gets isolated. Is it specifically when the bite comes from the mouth, or if like a cat would scratch you or something? Are there also fears of bacterial infections? It's only from the bites.
That's that's a challenge. So we know how animals behave. We know that cats lick the
Right.
palms.
Yeah.
So we address cat scratch exactly like cat bite, and we see infections after cat scratch as well as after a cat bite. It's the same.
Amazing. Yeah. And this is my last question on this, then we will move on to the next round.
Oh, we can speak about bite.
Yeah, no, it's really fascinating. So with regards to the crocodile bite, then do we expect, is it venom that's inside like the crocodile, because you mentioned the snake, or it's just literally bacteria, and so it's general infectious diseases, not disease, infection that's happening?
Yeah. It is just the damage from the bite itself and bacteria within the mouth, and there is no venom there involved in this injury. And also, in retrospect, we looked into the literature, the medical literature about crocodile bites, and there isn't a lot. And it comes, there is relatively rich, even though not too much literature from Florida, obviously, as well as from South America. And fortunately, it's not a good literature because there aren't too many crocodile bites or alligator bites, and you should differ between the two. So we learned a lot from this case, and hopefully this is the last time that I'm going to encounter it.
Wow, amazing. So now we can move on to other questions about bites and infectious diseases. I think people probably enjoy hearing, though, about a crocodile bite in Israel. So the summer is coming to a close, and obviously, we're moving into the fall. But there was a big issue in Israel this summer with West Nile virus that was said for many different reasons that it hadn't seen nearly as many cases in really decades, from what I understand. So I'm wondering if you can talk about, number one, the numbers, what really happened here in Israel now that the summer is kind of ending. And number two, if you can explain why we would have seen this phenomenon. And lastly, I'll just add on, are we going to be concerned about it as we enter the fall?
Okay. So I think that the last time that we had a larger epidemic of West Nile virus infection in Israel was in 2015, if I remember correctly. But we have it every year during the summertime when there are more mosquitoes and mosquito bites. Why we had this increase this year? Well, we don't really know. Obviously, the number one explanation is the global warming, and we know that this was one of the warmest summers in Israel as well as globally.
Right, record June and July.
Yes. So what happened is that there was early and a big increase in the number of cases of West Nile infection in Israel. It came earlier than usual. Then it was mainly it mainly affected the population in the greater Tel Aviv area. In the northern part of north to Tel Aviv, in Kfar Saba, etc. And one may wonder why. So I was wondering why, and I did a little research about that. So, well, first, Jerusalem area is less humid than Tel Aviv area, so this is there is less support for the expansion of the mosquitoes, even though there are mosquitoes in Jerusalem. Second is that mosquitoes don't travel a lot. So the mosquito female travels up to 2 kilometers. So if there is a mosquito in Tel Aviv, it's not going to come to Jerusalem. And then the mosquitoes don't get it. They are infected, or they become carriers of the virus from different birds that travel over Israel during this time of the year. So I thought that maybe the water avid birds, there should be a better expression for that. They carry the West Nile virus more than other birds that fly over Jerusalem. There are many birds that fly over Jerusalem, and we don't really know that. And nobody, I was asking several people, nobody really knows what's the prevalence of West Nile among the different birds traveling over Israel. So it's probably a multifactorial phenomena related to which bird is there, and the mosquito that is there to be biting the animal, the bird, and then biting human beings. Having said all that, we did have few cases, actually quite severe cases of West Nile virus brain infection at Hadassah. This is at least to say an unpleasant disease for those who are severely affected.
And people that are immunosuppressed, older people tend to be the hardest hit, from what I understand.
That's correct. So we had some immunosuppressed patients, and we had more elderly patients that were affected with severe brain inflammation and paralysis, and even one patient succumbed from the infection.
Which I think is what's uncommon this summer. We don't normally see this we see West Nile virus, but we don't see such severe West Nile virus. And just going into the fall, I mean, the weather is changing. It's nicer out a little bit already, cooler in the mornings and the evenings. Are we expecting to see this kind of dissipate as the year enters?
Well, we do. We already do see a dissipation in the number of cases in Tel Aviv and Israel overall. Yes, speaking about global warming, so we have other viruses that are approaching us. One is the dengue virus. So dengue virus was, we thought it's only for travelers who are traveling to Southeast Asia that can have it. And then there is the big issue about vaccination against dengue. But recently there were I think there were about a few cases of dengue virus in the Sinai Desert.
Right, I saw that.
So we are just and we do have the Victor, which is a different kind of mosquito than the one that is transmitting the West Nile. So it is in Israel, and it's only a question of time. Well, at least that's what we think, until we're going to see the first local transmission of dengue in Israel. Thus far, it was only from travelers, and it's going to be autochthonous. That's the professional terminology for local transmission of an infection.
It's actually quite striking, because you usually think of these kind of viruses as something, as you said, in Southeast Asia or in Africa. And, obviously we are Middle East, but you don't really feel that you hear about them in Israel. And you're thinking maybe it's tied to the climate change, to the heat, and the fact that we're not dealing with it, I guess, because it keeps getting warmer.
Yes, that's correct. The one of the main effectors of decrease in the number of cases of mosquito bites and subsequently West Nile virus infection in Tel Aviv was the handling of the mosquitoes by the local authorities. Well, actually, I live in Tel Aviv, and we had many mosquito bites until the Tel Aviv municipalities began to dry all the small water sources, the standing water, and spraying insecticides in our area, and then mosquito disappeared, and subsequently the number of cases declined.
So it really shows you how being on top of it is very important. Another thing that's really happened, I think, as a result of climate change is the spread of zoonotic diseases that come from animals to humans. We're starting to see more of that. COVID was certainly an example of that. And even though it's a different strain that we're seeing now, there's been this huge epidemic. The World Health Organization has said of Mpox in Africa spreading around. They're just starting to vaccinate. And we've seen that COVID-19 cases, once again, certainly in the United States and some other places, are starting to rise. Can you talk a little bit about that? And do you believe that, we're going to see Mpox come over to this side of the ocean again? Number one. And number two, what's happening with COVID in Israel?
So let me wrap these two viruses together. Monkeypox was an issue in the Western world when it was one clade that affected mainly MSMs. And then it significantly declined, and that's not an issue anymore. And now there is a resurgence of a different clade of monkeypox in Central Africa. And I think there were a few cases that in patients that were traveling to Europe, that there was no case in the United States. And I doubt that it's going to expand beyond Africa borders, unlike Ebola, or maybe like Ebola. But if you think about it, why ask me about monkeypox when you would have liked to ask me about avian influenza?
Oh, for example, which we have all over Israel. That's a good point.
Which you do have in the States.
And in the States, but also
yes, there was a local transmission, just recently, a local transmission of avian influenza in the United States that couldn't be traced back to a source. So that was very this is a concern about what I mentioned before, autochthonous transmission of a virus that could go on and spread. Well, fortunately, it hasn't happened. So there are many viruses that we can think about. There are many viruses that affect different populations, and we should be on the alert that what's going to affect us, and to be prepared for something which is going to be endemic or hyperendemic or pandemic. Fortunately, this has not happened neither with the Ebola nor with the monkeypox. And when you think, same applies to, I think that how we are dealing with SARS-CoV-2 or COVID-19 now, and which is we are following very anxiously in the States, in Israel, and all over. And I am afraid that that maybe today it's overrated. And I would elaborate on that if I may.
Sure.
Obviously, the pandemic was terrible. And if you look at the global mortality, so there were two peaks, outstanding peaks. One was in 1918 with the influenza pandemic, and then there was the one in the 2020 with the COVID-19. So this was, and it killed many people. There was an excess mortality, no doubt about that. Nowadays, we have what is called hybrid immunity, which is vaccination plus previous infection for most of the population, at least I'm not sure about Africa, but obviously in the Western Hemisphere. And people can become infected with COVID, but this is not a serious disease for the vast majority of the population. It's fascinating because at the very early days of the COVID-19, Anthony Fauci already predicted that this is going at the end to be just regular upper respiratory tract infection. And I thought that I couldn't believe it at that time, but obviously he was right, like many other things which he said. So, and today I think that addressing COVID-19 or asking me about COVID-19 in every interview is it's maybe symbolizes the failure of the infectious disease community at large, not only in Israel and not only in the United States, but all over the world, because From the very first day, we knew how, we learned how COVID is transmitted, and we knew what to do to prevent it, like wearing masks and isolation, personal isolation, etc., etc. And this was very important at the time. But all these measures are relevant to all the other respiratory tract infections, like influenza and like RSV and like other respiratory viruses. But this expansion of the principles of preventing infectious diseases never occurred. So people can tell me, well, I have a respiratory tract infection, come to work, I have a respiratory tract infection, but I tested, it's not COVID, so everything is okay. Well, it's not okay. All other respiratory infections can be transmitted to other patients and to other people and cause infection, which could be even more severe than COVID nowadays. So this is a dynamic issue, but we failed in explaining the population that what we learned about COVID should now be applied to all infectious disease, that you should respect the health of your colleagues and other people. And if you are sick, so you shouldn't go to work, shouldn't expose yourself to other people. And people don't do that, just the opposite. If it's not COVID, so everything is okay. So I think this is a real failure. And just as an example, there are many interest groups that are associated with it and that push it further. And I'm not trying to say that COVID is not important. It is important, and there is the issue of long COVID, which is an issue. That's all true. Nevertheless, if you ask yourself, how many people now, what's the risk of a patient, of a person who is become infected with the SARS-CoV-2 to be hospitalized or die, and he's not immunosuppressed? It's about 0.7%. And what's the risk for influenza? Same, 0.8%. But nobody cares about influenza.
Because we're used to it.
Yes, because you are used to it, but it kills. It could kill. Probably it kills today more than COVID-19. But there are drugs that could. So what I think is that we should treat COVID patients. We should think about the treatment of COVID patients, and this is supported by the current literature that we should treat those who are severely immunosuppressed, those who can become, who could die from the infection, but otherwise we shouldn't pay so much attention to the COVID, but to respiratory tract infections as a whole.
And it's interesting what you're saying, because I think that maybe you can speak a little bit to this, the pandemic treaty that is being negotiated in the World Health Organization. It's actually fascinating because it seemed like something we should have learned a lot of lessons from COVID, as you said, and people should understand that we need to translate over to other existing respiratory diseases, but also some of the principles of how to manage this and what kind of world reaction and tracking and, vaccination needs to be. But it seems that we've kind of forgotten all the lessons. Do you feel that there is a chance still to get the world on board with some of these basic best practices, and also with regards to health equality, then to be able to ensure that the whole world has access to what's needed, not only for COVID, but for any potential pandemic, so that we don't see a COVID repeat?
Well, I think that we are going to see a repeat of COVID. It's not going to be COVID, it's going to be something else, and it would happen. And I'm certain that we will be more ready for this when it comes. So there are many issues, current issues with COVID-19. It does severely affect immunosuppressed patients and the very elderly. and there is the issue of long COVID, which we should address. But besides that, we should understand that all the investment by the companies and by the governments for the treatment of COVID is now maybe less of an important than addressing other issues, health issues, I mean. The population is now well vaccinated and well protected, irrespective on the number of vaccine doses. I mean, you could get one more shot and two more shots, and you could get the updated vaccine. But the immune system of the people is now well adapted to protect against COVID, against severe COVID, even though you could become infected. And same applies to the treatment, because there is a treatment for influenza, but which, as I mentioned, causes severe infection in a very small minority, but does cause severe infection and death. And there is a treatment which is probably not very effective against it. And you may say, well, Paxlovid is effective. It is effective similarly to the influenza treatment. It was very effective, highly effective. It significantly reduced mortality and hospitalization at the early days when people were not vaccinated. But nowadays, it's different. And we know that the treatment with Paxlovid for the whole population is reducing non-significantly the number of hospitalizations. And so why do we get so much treatment? Because it's free. Because well, it's not really free. It's the government who, I think also in the States, but definitely in Israel, it's the government who buys the treatment and distribute it to the hospitals, so we can get it as much as we want and give it because we can. It's not a bad thing, but it's really not where I think the government should invest its money. There are new medications that are coming to the market. There is a new second generation of Paxlovid. I think it's called something like Ibuzadrilvir or whatever. And obviously it's going to be more effective, and there's going to be a lot of investment at testing its efficacy, and it's going to be efficacious. Is it important? Time will tell.
Interesting. So I wanted to switch over to travel for just a moment, because one of the issues with infectious disease is often tied to travel, spreading of the diseases for sure. I just was traveling in Africa not so long ago, and I ended up not taking new vaccinations, mostly I think because I'd had them before, but there is a list of recommendations. Like I was in Nigeria, yellow fever and that kind of thing. So I'm wondering, what should we be thinking about if we're going to travel to some of these places? And are there certain precautions that you highly recommend people take if they know they're going to a country where there might be infectious diseases that they're not used to in their own country?
So, yes, and it depends on the destination, and many good guidelines as to what precautions should be taken for each destination and what vaccinations one should take before travel. And we also have this travel clinic in Israel. We have one, and we have an expert in travel medicine here at Hadassah. And whoever comes, so we provide them the protection before the travel, and we also are happy to see them once they return if they have any kind of disease afterwards upon the return.
And how effective are the vaccination programs that we have in Israel against infectious diseases? We obviously have the standard childhood vaccinations, and people have an option to get a COVID vaccine or flu vaccine, as you said. Are there other vaccinations that we're taking here that we should be taking here?
So there are the routine vaccination program in Israel, which is very good. It really follows very tightly what is recommended in the States. There is a lag period between introduction of vaccine in the States and in Israel, but eventually it does come here. and it's a very effective vaccination program. One could understand that from seeing what's happening when people are not vaccinated. And we do have these pockets of unvaccinated populations in Israel as in the States, and there where we see the outbreaks. So we recently had a terrible case of a baby who died from an infection that could be prevented by a vaccination. We also had a polio infection from an unvaccinated child. So this is just a proof of the fact that if you are vaccinated, you are protected, and it's really not that difficult. It's just that understand that vaccines do have side effects, but overall the efficacy and the protection from diseases and from death from diseases is far more important than the minor adverse events.
And then when people do travel and they come back here, are there any specific diseases that we see more than others make their way into the country?
So everybody would like to speak about the malaria that we see, and dengue that we see, and worms that we see. But really what that is most common is regular skin infections.
Oh, interesting. Okay.
Yeah. And we see diarrhea that is just because you change your diet, and you have diarrhea, and it spontaneously resolves. So the more banal is the more common. Apologize for that.
It's allowed. I guess that's healthier. But what about let's say you get sick abroad and you're traveling? When is it important to go ahead and find medical assistance abroad, or is there any kind of symptom that you say, oh, that could be acute? Don't get on the plane and come back to Israel and wait.
Well, it's very important to have the vaccination, to finish the vaccine program before travel, and then know where you're traveling to. I was just consulted about a young couple who planned to travel to Thailand, and they discovered that she was pregnant, a very early pregnancy, and I was asked, should we travel or not? Well, this is a risk management that people have to take. There is Zika, and obviously the issue is Zika. So there is Zika virus in Thailand. It's circulating there. We don't know if it's in the peak now or not, but it is there, and people should decide if they want to take the risk or not. Same applies to other diseases. I think that it's the issue of what risk you would like to take, and I personally wouldn't limit myself from adventurous places if I could, but I would protect myself as necessary beforehand.
It's good you brought up the Thailand thing. I'm actually planning to go very soon, another few months, so I have to pay attention to Zika and see what I'm going to do there.
Don't get pregnant.
Well, that will not be a problem. Believe me, that will not be an issue. But so I'm a little old for that. But anyway, in terms of other emerging trends and technologies, is there anything that Hadassah is doing that is unique or we should know about in the infectious disease, either research or treatments, that would fascinate our listeners?
So what we do develop more, I think that we are more advanced. We started earlier, and we are more advanced than other medical centers in Israel, is implementing whole genome sequencing into our routine microbiology lab. So we are, and this is really fascinating because we unfortunately have some multi-drug resistant bacteria. And I won't go into the details, but they the bacteria have the same name. We isolate one bacteria, same name, from different patients, and it carries the same resistance mechanism. So bingo, we have transmission within the hospital, and we should track that, and we should see how it occurred and prevent it. And then we sequence these bacteria, And we find very surprising things like the bacteria which we thought were related are unrelated. And on the other hand, we find bacteria which are related, and we didn't think about them as cross transmission between patients. And it could be a transmission within the hospital. It could also be a transmission in the community that is coming into the hospital. So the whole genome sequencing, which is the new, and it's not a new, it's an advanced technology that the new is the implementation of it into the routine of the hospital, is gives us a lot of power in understanding how infectious diseases evolve and how they spread, and what's the role of the community and what's the role of the transmission within the hospital.
And with that, I mean, I'm assuming that antimicrobial resistance is something that you're going to then be able to pay attention to and track if you're doing the genome sequencing. And how much of a problem is that becoming in the hospital in terms of, diseases that are spreading that cannot be treated with antibiotics? And what are you finding from that research?
So, well, this is a big issue. This is a thing which is dear to my heart, and this could be a podcast by itself.
Yeah, and it probably should be at some point.
So, what we try to do is personalize the treatment for the infections. It's because if we treat infections like we treat like mass treatment with antibiotics, as was previously or is currently done to an animal in an animal farm, so we are going to end up with a significant increase in resistance. And using newer drugs to treat multi-drug resistant bacteria freely is going to cost us, not in dollars, but also in dollars, but far more important in biological cost of selection of resistant bacteria to these last line antibiotics. So what we are trying to do is to tailor the treatment to the bacterium and to its resistance mechanism. And actually what we are doing at Hadassah is that when we have patients who are infected with end-of-the-line resistant bacteria, we tailor the treatment according to the susceptibility that we test in our lab, which is not done elsewhere. And we can provide a very narrow and biologically cheap antibiotic combinations that are not administered elsewhere and that are at least as effective. And we have collected a very nice number of patients who were successfully treated that way.
Yes. Is there anything else you want to add that I didn't ask you or we should have talked about today?
Bring the hostages now.
Amen to that, for sure. Well, thank you so much, Professor, for being with us today.
My pleasure. Thank you.